Hi, I am Dr. Franck Yata, and thank you for joining me. Today, we're starting this long journey on explaining and helping get the erectile dysfunction problem managed. 50 plus years old myself, I dealt successfully with it just a few months ago. So here, in this program, I will be sharing knowledge and expertise that I gathered from being medical doctor for more than 20 years, and I will be talking from my own experience too. On this number one episode, I will plant the basic education of the erectile dysfunction. Then for the next episodes, I will share and exchange a lot of details with you guys. So make sure you subscribe to the YouTube page and follow me all over the social media to not miss any upcoming episodes. ED is not a taboo subject. It's not to be ashamed of. And mostly, it's not fatal nor final. It is curable. You can overcome it. You just need to learn more about it from an educated source like this channel. Make sure you handle most contributing factors and use some of my particular massages, exercises, and ingredients recipes I put together. Being from Africa is of more benefits because, as you may know, most indigenous African foods and practices make them suffer less from ED. I strongly believe that with your active interaction, this open class will be the place where questions will be answered and concerns and limits will be dealt with. So welcome to the course. Here I will help you get a clear knowledge of its causes and the many ways to address them. Whether you are here to learn for personal knowledge or to support someone else, this course will provide you with a comprehensive overview of ED, including its physiological, psychological, and emotional aspects.
Okay, Frankie, less talking. Now let's get into it.
Yes, you're right. Now, what is erectile dysfunction? Also known as impotence, it is the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. While occasional difficulty with erections is common, persistent ED can indicate an underlying health issue. Prevalence. ED becomes more common as men age, affecting a significant percentage of men age 40 and above. However, it can affect men of any age and may be a sign of other health problems. How? Mostly due to insufficient blood supply to the penis, but also early release of the enzyme phosphodiesterase type 5, PDE5. What are the most common causes? ED can result from various factors, which can be physical, psychological, or a combination of both. A. Physical causes. Cardiovascular disease, poor blood flow due to narrowed or blocked blood vessels can lead to ED. Diabetes. High blood sugar levels can damage blood vessels and nerves, affecting erectile function. Hormonal imbalances. Low testosterone levels can lead to ED. Neurological disorders. Conditions like Parkinson's disease or multiple sclerosis can affect nerve signals related to erection. Medications. Certain medications, e.g. antidepressants, antihypertensives, may have ED as a side effect. Obesity and sedentary lifestyle. Poor lifestyle choices like a lack of exercise and poor diet can contribute to ED. B. Psychological causes. Stress and anxiety. Psychological stress, especially related to sexual performance, can interfere with normal erectile function. Depression. Mental health conditions like depression can reduce sexual desire and function. Relationship problems. Emotional or relational issues can lead to ED due to stress, anxiety, or lack of intimacy. Diagnosing ED involves a combination of patient history, physical examination, and diagnostic tests. It takes a professional medical doctor to do it. Do not conclude to ED by yourself. Okay, what about the treatment? Treatment depends on the underlying cause of ED and can include lifestyle changes, medication, therapy, or surgical options. First, let's see the basic principle that most doctors do. Then, I will introduce my originality. Now, what do I do different? 1. Perineal massage. 2. Extended Kegel exercises. 3. Natural African ingredients. The combination of these 3 specific and original techniques added to the management of underlying pathologies has shown evidence of a notable improvement.
Thank you for watching these basic informations. Now let's go to episode 2 where good things start. Don't forget to subscribe and like the page for more contents.
Hello, as we said last time, erectile dysfunction is a medical diagnosis. Just because you've had a breakdown with your wife once or twice doesn't mean you should assume you have erectile dysfunction. Yes, it's after seeing a specialist, usually a urologist, and after undergoing a series of medical and laboratory tests that the doctor will declare you suffering from erectile dysfunction. Knowing this is very important so that you do not consider yourself suffering from a disease that you do not have, because then it will only worsen your situation and your mental state, which is an important part of erectile dysfunction. That being said, let's begin the second episode of our program. Today, we will describe in detail what this dysfunction is.
Although its definition may be clear and simple, let's see in more detail what it is exactly.
Erectile dysfunction is the inability to achieve and/or maintain an erection sufficient to satisfy one's spouse, or better yet, one's wife. We want to make this clear because, for us, intimate relations are between a man and a woman within the framework of marriage. This is also why we strongly advise our patients to bring their wives to the consultation. I should note that some men do not prefer this, but this is our recommendation. Now, back to the definition. If you manage to get an erection, but it is soft, it is not firm and hard like a stick or a rod, to the point of performing penetration and possibly making several back and forth movements, this is already a warning sign. Before going any further, I would like to clarify one thing. It should be noted that the shape the penis takes when erect, which is called the phallus or penis, does not constitute an erectile dysfunction. There is a semantic difference between the penis and the phallus or penis. The penis is the male genitalia when flaccid, while the phallus or penis is the male genitalia during erection. So, the penis can take several different shapes without it being considered erectile dysfunction since the penis is already erect. We can talk about the impact and cause of these penis shapes in another show.
But doctor, what are the main erectile dysfunctions?
There are at least 3 types of erectile dysfunction, 2 of which are the most common. These are premature ejaculation and sexual impotence. The third disorder, less common, is priapism, which is an erection that is exaggerated in duration, but often also in hardness or firmness. This can have destructive consequences on the penis as an organ. Premature ejaculation is, as its name suggests, a disorder in which the erection can be firm and hard, but does not remain so for long. Often, from the very first movements of penetration, ejaculation occurs practically to the disappointment of the man himself, and of course, without his will. This disorder is by far the most common, but fortunately the easiest to cure. Sexual impotence is a disorder in which an erection may or may not exist. When it does exist, it is partial and soft, and therefore not hard enough to allow for proper back and forth movements, and thus satisfy the partner. It is most often secondary to an underlying problem. Regarding penis size, it should be noted that the size of a man's penis has nothing to do with erectile dysfunction. The size can be small or large. As long as the penis can achieve a hard and firm erection, there is no talk of erectile dysfunction. The other case of sexual impotence is when the penis does not enter into an erection at all. We then speak of total sexual impotence. It can be primary or secondary. We will discuss this later. However, we must distinguish 2 things. There is physiological impotence, also called refractory period, which is normal and which occurs immediately after ejaculation. It takes on average 20 minutes, even less in younger men, and up to an hour or 2 in some older men without it being abnormal before a new hard and firm erection appears again.
The question, doctor, is where do I fit into this whole description?
Well, it's up to you. Who follow me to situate yourself. What are the signs you observe with the lady at home? The most important thing to know is that most erectile dysfunctions, about 90% of them, are secondary to underlying pathologies or situations that are absolutely treatable or controllable, if not totally. But proper care can bring about a significant improvement to the point of bringing the couple's intimate life back to normal. These causes are therefore essentially organohormonal, psychological, and due to the taking of certain medications, which is what will constitute the content of the following episode. Don't forget to subscribe to our YouTube channel, like and share all our videos, and of course follow us on all our social media accounts. Hello, I'm Dr. Franck Yata. Thank you for joining us for the 3rd episode of our series on erectile dysfunction. Today, we'll be exploring the causes in detail. If this is your first time joining us, I would ask you to start with episode number 1 instead. But first of all, please subscribe to our YouTube channel, like this video and every video you watch to support us. So, with that said, let's get back to the causes of erectile dysfunction. For each cause, we will make an effort to explain the pathophysiology that goes with it. That is, we will explain the disordered or abnormal functional mechanisms underlying the disorders discussed here. If we cannot exhaust them in this episode, we will continue to the next episode.
Yes, thank you, doctor. Let's talk clearly, but let's talk briefly. Can you start with the causes, please?
Okay, we can classify the causes of erectile dysfunction into 4 groups that can act alone or in combination. These are organohormonal, psychological, drug-related, and mechanical or traumatic causes. But before going into detail about the causes, it would be more informative if you had an idea of how a normal erection is achieved. What is the sequence of events that leads to a normal erection? So that you can understand what is abnormal. We will call it the physiology of erection.
Very well, doctor. So tell us about it. How things are normally done.
Okay, I'm going to start by showing you a video I found on the internet, YouTube channel Dar Alzacora, which I think describes what's happening relatively well. That way you'll have a visual idea before I go into detail. Let's watch.
Our circulatory system is composed of arteries, veins, and capillaries. The penis is one of the unique organs requiring a continuous blood supply to maintain its reproductive function. It is composed of 3 cylindrical spongy tissues, 2 corpora cavernosa, and 1 corpus spongiosum. During flaccid states, blood flow to the penis is low, and blood supply is insufficient due to the contraction of the trabecular smooth muscle fibers. Erection is a physiological process that generally begins with sensory and mental stimulation of the brain. These brain impulses cause the muscles of the corpora cavernosa to relax. The parasympathetic nervous system relaxes the vascular smooth muscles by releasing nitric oxide, which results in vasodilation. Blood flow and output increase, and the penis dilates, thus increasing its size. The expansion of the trabeculae prevents venous drainage by compressing the emissary veins between the 2 layers of the tunica albuginea. This traps blood and results in a full erection. This is called the passive veno-inclusive mechanism. Blood congestion occurs when blood flow increases and the helicon arteries straighten and dilate, allowing blood flow into the corpora cavernosa. Genital stimulation then induces a further increase in penile rigidity, called the bulbocavernosus reflex. Finally, after ejaculation, sympathetic innervation contracts the trabecular smooth muscles again. As a result, penile arterial blood flow decreases and venous drainage occurs, leading to a gradual evacuation of blood. The penis then returns to its flaccid state.
So, let's come back here and review all of this in detail. An erection begins with sensory and mental stimulation of the brain. The brain sends messages to the penis via nerves. The penis is made up of anatomically distinct smooth muscles that, once relaxed, have the capacity to expand. Messages from the brain then instruct these smooth muscles, especially the corpora cavernosa, to relax, allowing blood to flow and fill these bodies. The blood is then trapped under high pressure by a series of valves, thus creating an erection. In other words, it all starts with the brain, which is most often stimulated by a sensory receptor in the body, visual, tactile, olfactory, etc., and even by thought. The brain will then cause the vessels and cells of the corpora cavernosa to relax and expand to quickly receive more and more blood, thus increasing the size, volume, and firmness of the penis. At the same time, a mechanism of membranes and valves will prevent the blood from escaping, trapping it. This state will last as long as the desire and mental pressure are maintained in the brain. However, it should be noted that this desire and mental pressure seem to have a peak that should not be exceeded at the risk of triggering the ejaculation process. Usually, when this ejaculation process is triggered, it is irreversible. It will continue until the end, after which the erection process will also be reversed. At this point, the muscles in the penis will contract, cutting off blood flow. The pressure will decrease and the valves will open, allowing blood to flow out. The penis will then lose its erection and become flaccid or limp. So, we have just described the most common erections of the awake person. There are also spontaneous erections.
Hello, I'm Dr. Franck Yata. Thank you for joining us for the 4th episode of our series on erectile dysfunction. Today, we'll continue with normal functioning and then delve into the causes in detail. If this is your first time joining us, I would recommend starting with episode 1. But first, please make the gracious decision to subscribe to our YouTube channel, like this video and every video you watch to support us. Also, don't forget to follow us on all our social media accounts. That being said, be prepared for the causes of erectile dysfunction. Each time, we'll make an effort to explain the pathophysiology that goes with it. If we don't manage to exhaust them in this episode, we'll continue to the next episode. Let's go. Remember that in the last episode, we just described the erections of the awake person, which are the most common. There are also spontaneous erections, that is to say, those that occur without conscious arousal, whether voluntary or induced by a sensory stimulus. Some schools classify erections during sleep or those in the early morning as spontaneous erections. The important thing to remember here is that any situation or condition that will prevent, or partially, or totally hinder the occurrence of an erection, as we have just described, will, in reality, constitute a cause of erectile dysfunction.
So any element, circumstance, or factor that blocks this mechanism will lead to erectile dysfunction. So, doctor, all that's left is to name them and tell us how.
You've got it all figured out, and we've already said it. These are organohormonal, psychological, drug-related, and mechanical or traumatic causes. 1. Organohormonal causes. These are disorders that generally result in significant obstruction of blood flow to the penis. This is, for example, in the wake of A. Cardiovascular diseases, most commonly arteriosclerosis. In reality, it's any situation that reduces the cross-section of the arteries supplying the penis, whether in situ or upstream. In the case of arteriosclerosis, there are deposits of atheromatous plaques that will narrow or even block the arteries of the penis. This will, of course, result in the penis being unable to receive enough blood to enlarge and become sufficiently hard. The same mechanism is also observed in a man suffering from high blood pressure or heart failure for several years, where the rigidity of the vascular walls or rhythm disorders produce the same effect of reducing the blood supply to the vessels of the penis. The erectile dysfunction associated with this will be sexual impotence. It is also said that high cholesterol levels promote erectile dysfunction because cholesterol is actively involved in the formation of atheromatous plaques. Yes, cholesterol, you heard that right. The kind most often found in the foods we enjoy eating. So guys, pay close attention to your diet. The other major condition involved in the occurrence of erectile dysfunction is diabetes, especially type 2. In fact, diabetic men have a very high risk, and this risk increases with the duration and severity of diabetes. Therefore, managing diabetes through healthy lifestyle habits, medications, and regular medical checkups can go a long way in preventing or delaying the onset of this dysfunction. But how does diabetes affect erectile function? High blood sugar damages the nerves and blood vessels essential for erections, leading to a combination of macroangiopathy, microangiopathy, and neuropathy over the long term, and consequently, impaired erectile function. Sugar damage to the nerves that control erections will make it difficult to achieve and maintain an erection. Sugar will cause the same damage to the blood vessel walls, impairing their ability to expand and hold more blood. This is why people with advanced diabetes often experience soft erections. B. Hormonal causes. Hormonal imbalances, particularly low testosterone levels, can significantly affect erectile function by impacting libido, energy levels, and the ability to achieve and maintain an erection. Low testosterone levels, called hypogonadism, can lead to decreased sexual desire, difficulty getting erections, and other symptoms like fatigue and loss of muscle mass. Besides testosterone, other hormonal imbalances, including chronic kidney disease, can also contribute to erectile dysfunction. Examples include high levels of prolactin, a hormone produced by the pituitary gland, which can reduce testosterone production, or hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, both of which can also affect sexual function. It can also be an imbalance between estrogen and testosterone, where high estrogen levels can contribute to erectile dysfunction. The good news is that testosterone supplementation or balancing these other hormones can bring erectile function back into normal range, especially if that's the only problem.
So, thank you for the 5-minute episode. Coming soon, we'll be discussing the causes of erectile dysfunction related to your lifestyle choices, including alcohol, tobacco, and more. So don't forget to subscribe, like, and share our series. Thank you, and see you next time.
Hello, I'm Dr. Franck Yata. Thank you for joining us for the 5th episode of our series on erectile dysfunction. But first and foremost, please make the gracious decision to subscribe to our YouTube channel, to like this video and every video you watch to support us. Also, don't forget to follow us on all our social media accounts. So, let's continue with point C, lifestyle-related causes. Indeed, your lifestyle can profoundly interfere with your erectile function. The inability to control anxiety and stress, financial, professional, romantic, or family, has a direct impact on erectile function due to its significant psychological component in the brain. Lack of physical exercise, a sedentary lifestyle, and obesity can also contribute to, if not inevitably lead to, erectile dysfunction. But the good news is that with professional help, like what Dr. Franck Yata can offer you, these problems can be resolved. It should be noted that we can also classify here pseudoerectile dysfunction, which is in fact only a lack of knowledge or education on how to proceed or conduct an intimate act with one's partner. If you don't know how to do it, a lack of confidence or self-assurance combined with a feeling of shame at never satisfying your partner can lead to a mental blockage to the point of not getting an erection. This pseudo-dysfunction does not constitute erectile dysfunction as a disease, and it can definitely be corrected with a few sessions. Therefore, remember, erectile dysfunction is a diagnosis that must be made by a professional doctor after a careful examination. 2. Psychological causes. As we've said several times before, to have a fulfilling intimate life with your wife, your mental health, or better yet, your psychological health, must be in good shape. That is, your brain must not be preoccupied with emotional burdens other than desiring your wife. And even then, this emotional charge must not be excessive, otherwise ejaculations will often be premature. We will discuss this later. So, to return to psychological causes, any personal, family, social, professional, or other relationship situation, whether financial, material, or simply emotional, that strongly and prolongedly preoccupies the brain has an immense potential to lead to erectile dysfunction. Note that the chronicity or persistence of stress is a very important factor. This psychological dysfunction can manifest itself in the form of premature ejaculation or even sexual impotence, and it can affect men of all ages. Fortunately, in the absence of underlying pathologies, this psychological dysfunction is very curable. We will therefore cite among the causes any situation of stress and anxiety, including sexual performance anxiety, depression such as loss of interest in sexuality, interrelationship problems, previous sexual impotence, mental illnesses of other origins, etc. It should be noted here that lack of sexual interest or temporary mechanical impotence due to a specific illness or disability does not constitute erectile dysfunction. In other words, we should not talk about erectile dysfunction, for example, to a sick person showing symptoms such as pain, fever, or a distressed man who has just lost a loved one, or a sick person during a convalescence period, etc. 3. Drug-related causes. This includes medications such as neuroleptics given to the mentally ill, anxious, or depressed, or to people suffering from Parkinson's disease. It also includes antihypertensives, or excessive use of phosphodiesterase type 5 enzyme inhibitors, such as Viagra. Therefore, Viagra should be taken with great caution because it can produce serious side effects, including heart problems up to cardiac arrest, loss of vision or hearing, or in some cases, priapism. Priapism is a prolonged and painful erection that can last more than 4 hours with serious complications that damage penile tissue, requiring immediate medical attention. 4. Mechanical or traumatic causes. Any mechanical or traumatic situation that directly affects the spinal nerves, for example, or the vessels or organs directly involved in erection, to the point of causing discontinuity, can therefore lead to erectile dysfunction. Concretely, this can be the case during a traffic accident, work accident, a fall, a fight, etc. 5. Causes of priapism. We haven't talked much about it. Remember that it's a permanent, painful, and abnormal erection, unaccompanied by sexual desire or arousal. The main cause of priapism is taking certain medications, including those in the Viagra family. Certain lesions and injuries of the cervical spinal cord have also been associated with the onset of priapism. Hi, I'm Dr. Franck Yata. Thank you for joining us for the 6th episode of our series. Of course, if it's the first time, please start back with episode 1. Today, we'll be talking about diagnosis and treatment. First, let's quickly talk about diagnosis. As we've said several times, diagnosis is primarily a decision made by the medical specialist. This is extremely important to remember. Even if ED signs are obvious and clearly observable, it is only after a series of physical, laboratory, and even imaging examinations that the doctor will conclude that erectile dysfunction is present. Don't be convinced of a dysfunction that you do not actually have, because then it will only worsen your situation considering the psychological stress that it will bring. Remember that there are forms of erectile dysfunction that are temporary, or easily curable, or simply pseudoerectile dysfunction. In conclusion, take the courage to see a specialist for a diagnosis. So don't draw conclusions yourself. Now, let's talk about treatment. To start off, I would like to remind you that the purpose of this program is not to show you how to self-treat yourself from home, but rather to give you the broad outlines of the treatment principle for your information. The general treatment principle will have 4 pillars. The first is adjusting your lifestyle and taking certain oral medications. You will have to quit smoking, cut down on alcohol consumption, exercise regularly, lose weight if overweight, manage your stress and anxiety, and of course, get enough sleep. Taking medications that inhibit the enzyme PDE5 or phosphodiesterase type 5 can help to temporarily resolve the inability to achieve a satisfactory erection. But the problem is that you cannot take these medications continuously due to the side effects and serious risks they pose. Among these medications, you have, of course, sildenafil, the most popular of which is Viagra, tadalafil, including Cialis, vardenafil, including Levitra, and Avanafil, including Stendra. Their continuous use is therefore highly discouraged. In general, Viagra and its analogs do not exhibit physical addictive effects, but some people may become dependent on Viagra to achieve erections or to increase their confidence during intercourse, leading to psychological dependence. Not physical dependence, but psychological. In fact, they think they need it to have a good erection, but actually, they don't. When is the best time to take these meds? Sometime before intercourse. For example, for Viagra, approximately 1 hour before, while for Cialis, it's about 30 minutes before. And always take small doses. Contraindications. Remember that they increase blood flow by enhancing the effects of nitric oxide, which in turn induces vasodilation. This vasodilatation in the long term or at high doses can lead to dangerous hypotension. That dangerous hypotension will more or less immediately be responsible for a slow heart rate, dizziness, vertigo, fainting, or even cardiac arrest. In some cases, this severe hypotension can lead to a reactive hypertension and a dangerous acceleration of the heart rate, which can also lead to cardiac arrest. So, we never encourage the continued use of Viagra or similar drugs. Dr. Yata prefers other methods that yield much better results by focusing on physical and natural practices, including indigenous ones. If oral medications do not solve the problem, the second pillar of treatment will be based on physical, instrumental, and non-oral drug techniques. 1. Let's talk about vacuum erection devices or VEDs. These are clear plastic cylinders with an opening at one end that are placed over the penis. A pump is attached to the cylinder that draws air in to create a vacuum. The pump can be hand-operated or battery-powered. The vacuum reduces the air pressure in the cylinder and increases blood flow to the penis. A constriction ring will then maintain the erection. The DEV is non-invasive and safe in most cases. 2. Let's talk about penile injections. These involve injecting certain products directly into the penile tissue before intercourse. The action is generally rapid and effective in 80% of cases. 3. We can also talk about intraurethral suppositories, which are products introduced into the urethra at the tip of the penis using an applicator. Medications applied 15 minutes before intercourse can dissolve inside the penis, relax the smooth muscle, and facilitate the blood flow that causes an erection. They are less effective than injections. 4. In cases of premature ejaculation, some doctors recommend anesthetic ointments to reduce local sensitivity and thus reduce the psychological pressure that can trigger the ejaculatory process. 5. Also, in the case of premature ejaculation, mental defocusing or deconcentration techniques are recommended to reduce psychological pressure.
Thank you for joining us for the 7th episode of our series. Hello, I'm Dr. Franck Yata. Today, I'll be talking about the uniqueness of my care plan. But first, I'd like to ask you to please subscribe on YouTube and all other social media to support us. We ended episode 6 by saying that in the case of premature ejaculation, we also recommend mental defocusing or deconcentration techniques to reduce psychological pressure and thus maintain an erection for as long as possible. As you know, there is a threshold or peak or summit or highest point of mental arousal that should not be exceeded at the risk of initiating the ejaculation process. If a man can consciously control his ability to reach, or better, not reach this threshold, he will theoretically never experience premature ejaculation. Today, there are several techniques that allow you to voluntarily control this threshold. We'll discuss them in later broadcasts. And in our private consultations, we learn how this works in practice. The third front of erectile dysfunction treatment is surgical, where the doctor primarily prescribes penile implants. This front is recommended when the previous 2 treatments have not yielded good results. However, it must be recognized that the satisfaction rate is quite high here. The fourth front will involve addressing underlying conditions. For example, the doctor will prescribe testosterone replacement therapy, TRT, which aims to restore testosterone levels in men with low testosterone. This treatment can help relieve symptoms such as low libido, erectile dysfunction, fatigue, and muscle wasting. However, TRT also carries potential risks, including an increased risk of prostate cancer, heart problems, and polycythemia. The doctor will also add psychological therapy, especially if anxiety, depression, or trauma are contributing factors. He will likely prescribe couples therapy to improve intimacy and communication, which is extremely important in the management of erectile dysfunction. In fact, most of these treatments, especially those on the first two fronts, are applied for every intimate relationship. Whereas we should be thinking of finding a solution that would allow the patient to recover his erectile function, as in the good times of his youth. This is why the next chapter will be particularly interesting, as I will present my treatment principle and its originality. Erectile dysfunction, Dr. Yata's treatment principle. Based on my training and my medical practice of 20 years, combined with the experience of my close environment made up of peers over 50 years old, and especially my own experience as a couple, I have been able to offer a treatment that gives positive results. Indeed, without neglecting or contradicting the basic principle of treatment that I have just described, it seemed essential to me to add the following techniques and actions. 1. Specific pelvic massages, such as those I offer. Here, a professional therapeutic masseuse, to whom I have meticulously taught my technique, will perform this massage on you, preferably in the presence of your wife, so that if necessary, she can perform it herself at home. 2. Modified Kegel exercises, as I suggest them. Here, a fitness coach, who I also taught the exercises to, will guide you for a good period. 3. Natural ingredients and dried fruits commonly consumed by men in the villages of the Democratic Republic of Congo. Here I will recommend taking natural products in a combination, the proportions and frequency of which I suggest. 4. Active participation of the partner on both a psychological, mental, and physical level, including an audiovisual component. Some men do not want this, but this step is crucial in our approach. Your wife is entirely part of the problem, because it is the lack of her satisfaction that hurts you the most. So she must be just as much part of the solution process. This comprehensive approach is original and sets me apart from other doctors who treat erectile dysfunction. I will talk about it superficially, but if you want to know more, you will have to visit our official website and take the first consultation, which is completely free, in order to establish a treatment principle that corresponds exactly to your situation. Remember that dysfunction is actually primarily a psychosomatic manifestation that depends deeply on each individual's situation. Therefore, treatment is personal. What works for him won't work directly for you. One thing to remember is that erectile dysfunction is not and should not be a taboo subject. You must be able to talk about it freely. If you suffer from it, know that it is not a shameful subject either, and above all, you are not alone. There are 400 million other men who suffer from it. Hundreds of thousands of doctors have chosen it as their specialty, so you are not alone at all. And finally, it is curable and it does not kill. So, that's the end of the basic and introductory course we've planned for you on erectile dysfunction. Thank you for following us so far. If you'd like, we'll start live broadcasts to answer your questions in real time, either publicly or privately in a chat box. Thank you for your support. Now, let's get on with the interesting discussions and answer your questions. Feel free to ask questions and above all, contact us by phone or visit our official website.
Hello, I'm Dr. Franck Yata. We've completed the basic course on erectile dysfunction. We'll now present topics based on your requests. So, feel free to suggest topics related to our main theme. Since our channel is in its very early stages, I suggest you subscribe, like and share so that many can benefit from it.
So, today we will try to answer the question, how does stress cause erectile dysfunction?
Many people believe that psychological factors like stress and anxiety are responsible for erectile dysfunction. Well, yes, this is indeed true, and according to recent studies, it's true in over 80% of cases. Some people may wonder what stress, anxiety, and even depression really are. In fact, in the context of erectile dysfunction, they are the same thing in the sense that they produce the same consequences. To make it easy for everyone to understand, we'll define them as follows. Stress is a mental state in which the level of brain arousal is very high, leading to intense mental agitation. Its physical manifestation is often fatigue and decreased concentration. Almost always, stress arises from a difficult situation in the patient's real-life environment. There is a cause and effect relationship when faced with a major problem. Anxiety is a mental state of fear and excessive worry about a situation that has not yet occurred, but is likely to occur. In fact, the anxious person is mentally blocked. Their brain functions are severely disrupted by fear of a possible negative outcome. There is no cause and effect relationship. Depression is a mental state where the depressed person has lost all interest and is even suicidal off what is happening because of several unfortunate events that have happened to him or that he is afraid might happen. The person is sad, desperate, and tends to give up on everything. In this case too, there is a blockage or profound alteration of the humoral functioning of the brain. In all three cases, the brain appears to be overworked and in stress management mode, meaning that it is almost continuously activating its sympathetic neural system. This is not the parasympathetic system, which is known for its relaxation and calm, in which the brain carries out the process of sexual erection. If you want to know more about the difference between the sympathetic and parasympathetic nervous system, we'll cover that in another show. In summary, and in fact, stress, anxiety, and depression will exert a negative cerebral influence on sexual arousal, which will cause an alteration of desire, hence the reduction of erection, or even impossibility.
So, doctor, what do you say when there are no underlying diseases, but ED is present?
How do you know if your erectile dysfunction is psychological or organic? Organic means there is another previous or coexisting disease or condition causing the dysfunction. Well, when you have erections while sleeping or masturbating and no underlying conditions, the main factor involved is usually psychological, and it's almost always stress, anxiety, or depression. In this case, it's not an organic problem.
What is the actual brain's action to create erection?
One thing to remember is that the erection process begins with perception, meaning the brain must be able to properly use its 5 senses: sight, touch, smell, hearing, and taste. There is also talk of a 6th sense, if you want to call it that, which is thought or memory. Unless it is during sleep, where the process is a little more complicated, the brain almost always uses these first 5 senses of perception to induce erection. So the brain must have collected and processed enough information through sight, touch, smell, etc. to be able to send the order to the penis, through neurotransmitters and hormones, to initiate the erection process. These are notably testosterone and dopamine. To do this, the brain needs to operate in a relaxed mode to produce a good ejaculation. Because in reality, the purpose of an erection is ejaculation. Ejaculation is, in fact, the body's natural process par excellence for regulating stress. Indeed, sexual activity and ejaculation provide benefits including positive effects on the heart, brain, immune system, sleep and mood, prostate, etc. So the brain achieves this through its parasympathetic nervous system. Now, the parasympathetic system directly opposes the sympathetic system. When one is excited, the other is inhibited, and vice versa. The proper functioning of the entire organism lies in the balance of their actions. We will discuss this in detail in another program. Thank you for following us. Please continue to the next episode to see what happens next. In the meantime, remember that the intimate act has a framework. That's the marriage.
Hello, I'm Dr. Franck Yata, and thank you for joining us. Last time, we discussed that the balance of the sympathetic and parasympathetic systems ensures the proper functioning of the entire body. Today, we're sharing 6 things you can do to overcome stress, which is essential to a good erectile function. But first, let's wrap up on how stress affects your erectile capability. So stress will excite the sympathetic system and thereby inhibit or deactivate the parasympathetic system, with the logical consequence of preventing the normal functioning of the erection. In other words, stress, anxiety, and depression have direct access to the brain, ordering it to disable or reduce sexual performance. Not only that, but they also trigger the production of oxidants and other toxic chemicals, particularly in aging, cancer, cardiovascular processes, and more. Believe me, no one wants to let constant stress develop in their lives. So absolutely don't let stress, anxiety, and depression destroy you. Finally, and we'll talk about this later, we must also keep in mind that the male sex is a muscular organ. It is itself attached to a muscular floor called the pelvic floor, and it needs to be in good shape to perform better. Hence the Kegel exercises and other local massages that we also offer. Ejaculation. This is probably the right time to talk about the process that initiates ejaculation. First, you should know that the brain seems to have a peak beyond which it irreversibly triggers the ejaculatory process. Quick note: don't confuse ejaculation and pre-ejaculation. After forming an erection, many men emit pre-ejaculatory fluid during stimulation prior to ejaculating. This is not a formal ejaculation yet. Ejaculation is triggered by a combination of spinal reflexes and cerebral influence, primarily initiated by stimulation of the genital organ. This stimulation, most often mechanical, sends signals to the spinal cord, specifically to the spinal ejaculatory center, SEC, located in the lumbar region. When these signals reach a certain level, the spinal ejaculatory center will send a signal to the brain, hypothalamus, to coordinate the release of sperm and the contraction of the muscles responsible for expulsion. The first lesson here is that if you are sufficiently aware, you can manage this level and then being able to delay the ejaculation more longer. Well, it's not easy, but it's entirely possible, with a lot of mental training and willpower. This is where defocusing or deconcentrating techniques can help. The second lesson is that if the pelvic floor muscles are flexible and exercised, they will not get tired more quickly during intimate intercourse. As a result, they will not send the signal to the brain to initiate muscle relaxation and blood expulsion, resulting in more erection time. As you can see, any method that delays ejaculation helps solve the problem of erectile dysfunction. This is also what oral medications do by inhibiting the phosphodiesterase type 5 enzyme, such as Viagra.
So, doctor, what shall we do to overcome stress?
Well, from a stress perspective, when signs of erectile dysfunction begin to appear, the 6 following steps should be taken. 1. Get closer to your wife morally, mentally, and especially physically. Without waiting for her to apologize in case of problems or disagreements, seek her out and approach her. Align your views, and if necessary, ask for his forgiveness. This will have an impact on your sexual strength. 2. As far as possible, find solutions to problems that may be causing stress. Fix the disturbed interpersonal relationships, family or work, go out and socialize with others, talk about it or seek help from experts, look for a financial solution, talk to your religious leader, etc. 3. If you want to be alone, plan to feel good and relaxed. Do what you seem to enjoy. Relax, travel, or change your surroundings if you can afford it. 4. If necessary, improve your lifestyle. Stop consuming stimulants, coffee, tobacco, alcohol, and other psychoactive substances. Adopt a balanced diet. Take steps to ensure good sleep. Engage in regular physical activity and adopt relaxation techniques. 5. Practice dance and classical or soft music. 6. At the same time or after trying the above, take anti-anxiety medications, and even small doses of PDE5 inhibitors from time to time. Thank you for following us. Please continue to the next episode to see what's next. In the meantime, I ask that you kindly subscribe, like, and share our videos so that many can benefit from them.
Hi, I'm Dr. Yata. As you know, the channel is in its early stages. I would like it if you can subscribe, like, and share to motivate me for more content. After episode 9, and at the request of many of you, I am pleased to talk again about how to overcome stress, anxiety, and depression. Well, stress, anxiety, and depression have in common the fact that they put a lot of pressure on the brain, putting it into a permanent state of high excitement. The brain then operates almost always in sympathetic mode. We talked about this last time. From a blood point of view, there is constantly more blood reaching the brain, generally under high pressure that is a risk for stroke. More glucose, more adrenaline, and cortisol, which are responsible for super excitement and psychological and mental irritability, but also physical fatigue. So in a situation of continuous stress, the brain's functioning is completely overloaded. It gets crazy. You can compare it to a freeze computer that keeps running forever, either because of a virus that infected the computer, or there are so many commands that the processor speed or memory can no longer keep up. Most of the time, the solution is just start over. Allow the RAM to clear of the many actions and commands in progress. Most often, a simple restart of the computer fixes the crash problem. Well, it's a similar process with a brain in the midst of a stress, anxiety, or depression crisis. That's the key. If you understand this comparison, you might have an idea of how to escape the grip of stress. So let's put it another way. Everything happens in the brain, or better, in the brain's perception. The secret to overcoming stress, anxiety, and depression is in your head. You don't have to look elsewhere. Stress and anxiety are not like an infectious disease where a microbe infects you and produces the disease. No, it's not like physical trauma where you get stabbed and you have to stitch it up. No. It's a problem of perception at the brain level. It's essentially an image the brain creates about the difficult situation you're going through right now or in the future, which the same brain struggles to resolve, using all the resources it can. Besides, originally, stress is a self-defense process that the brain puts in place to get you out of the danger it thinks you are in. Think carefully. It is the brain that automatically puts you in a state of alert or stress. It does this without you asking any questions when there is a fire, an accident, danger, etc. It produces adrenaline, cortisol, and others, so it automatically puts you in sympathetic nervous system mode. So to fight and eventually overcome stress, you have to trick your brain into believing that you are not in danger, and that the problem you have is not a danger to you. You don't consider it as being able to put your life at risk, nor the lives of people you care about. The love, social, financial, or professional problem, etc. is not a big deal for you. Make a voluntary effort to minimize it. Make it like a brain reboot. Give to your brain new information. Make him reconsider the current problem you're experiencing. Only in this way will you be able to overcome the condition and the consequences of stress. If you can mentally convince your brain to reconsider things, believe me, you will have already overcome stress 80%. Everything happens in the brain. There is no drug solution at this stage, one that you have to drink or inject to resolve stress. This is why, unless it is a placebo or a tranquilizer, the psychiatrist or psychologist has no other instrument than speech during the consultation or treatment.
But doctor, how can we actually do this? The 6 points or things to do and how to approach them.
Before returning to the 6 points I mentioned in the last episode, I would like to add this. For those who do not know, the active brain operates in an electrical mode by emitting electromagnetic waves, which have different frequencies depending on the state of activity, wakefulness, or sleep. Simply put, each level of physical or mental activity corresponds to a specific brainwave frequency. Since stress is observed when the brain's overall frequency is very high, any technique that lowers this frequency will also reduce stress. Today, there are several scientifically proven techniques that allow you to lower brain frequencies. Based on their frequency values, expressed in hertz, we distinguish 5 different types. From the lowest to the highest frequencies, we classify delta, theta, alpha, beta, and gamma waves under the acronym DTABIG. We will describe them in the next episode. As you begin to understand, overcoming stress will involve how you make your brain reconsider its perception of stress, and how you can use personal techniques to reduce the overall brain frequency. Hello, Dr. Yata here. Thank you for continuing with us. Today, we're moving on to the 6 things you can do to overcome stress, anxiety, and depression. In last episode, we discussed the 5 types of brain frequencies, from lowest to highest, expressed in hertz, 1 hertz representing 1 wave per second. We have delta, theta, alpha, beta, and gamma waves. The acronym DTABIG helps us remember this. 1. The delta rhythm from 0.5 to 4 hertz in frequency. This is the rhythm of deep, dreamless sleep, also observed in coma. 2. The theta rhythm with a frequency of 4 to 8 hertz. This is the rhythm of relaxation, or deep meditation. The brain is somewhere between wakefulness and the subconscious. This state is achieved in particular by experienced meditators. 3. The alpha rhythm, from 8 to 13 hertz. This is the typical rhythm of an individual with eyes closed, awake but relaxed or in light meditation. This is the state of the brain when we have just woken up or when we are lying down with our eyes closed, just relaxing. 4. The beta rhythm, from 13 to 30 hertz. This is the rhythm of a person who is awake and alert and actively processing information. This is probably the state of your brain while watching this video. It's also the brain of social interaction frequency. 5. The gamma rhythm, from 30 to 60 hertz. This is thought to indicate high brain activity, such as during creative processes or problem solving. This is the frequency most often used by the brain during stress. Regarding our main topic, erectile dysfunction, it is highly recommended to have intimate relations when your brain activity is lower than the alpha frequency. That is, calm and relaxed, with just the desire to enjoy the moment. However, it should be noted that it has not been scientifically proven that beta or even gamma brainwaves directly prevent erections. On the other hand, yes, beta and gamma brainwaves can fuel stress, which will, in the long term, negatively influence sexual function. Regarding how to lower brain frequencies, although the techniques are available today, they are beyond my expertise and the scope of this program. I therefore cannot discuss them. So back to today's question, how to overcome stress. In addition to making the brain reconsider its perception of stress and practicing techniques to lower brain frequencies, We must also add the need to maintain our bodies through consistent exercise and hygiene, without neglecting a responsible lifestyle. Physical exercise has the great advantage of bringing enough oxygen and sugar to the brain and everywhere else in the body, ensuring its proper functioning. In addition, they have the advantage of relaxing the muscles, allowing them to function better, including promoting better overall venous return to the heart. Hygiene practices will prevent the body from getting sick, thus sparing the brain from dealing with infectious and inflammatory stress, which has virtually the same impact as psychological stress, which we've described so far. Leading a responsible and safe lifestyle will also save the brain from being intoxicated by alcohol, tobacco, drugs, and harmful substances, avoid being overweight, etc. So, in summary, and to reiterate, what you need to do is 1. Retrain your brain to understand its perception of stress. 2. Practice techniques to lower brain frequencies. 3. Maintain your body through physical exercise and hygiene. 4. Adopt a responsible lifestyle. 5. If possible, address the direct cause of stress. 6. Take anti-anxiety medication from time to time.
Thank you, doctor. We understand. But would it be possible to go into detail about these actions to be taken?
Yes, of course, you must concretely do this. 1. Regarding the brain's perception, talk to yourself, tell yourself to calm down. If you believe in God, ask Him to bring you the calm and peace you cannot have on your own. If you are not a believer, I suggest you become one. This is probably the best opportunity now. Be positive. Believe that things will improve even if you don't see any signs yet. Believe that the situation you're in won't kill you. You'll get through it. Encourage yourself. Listen to or watch motivational messages. If you are unable to pour this, please consult a psychologist or psychiatrist for more professional help, or call us for further guidance. Consult your religious leader or spiritual father if necessary, but be careful. 2. Regarding brain frequency reduction techniques and what comes next, please continue with the next episode. If you've made it this far, it's because you found our show interesting. I therefore ask that you subscribe, like, and share our videos to support our efforts.